So I'll be talking on the mortality burden or case fatality rate of Ebola virus. So on average, from 1976, when it was discovered up until now, there has been an average case fatality rate of about 50%, and it could also range between 25 to 90% depending on how early it was diagnosed and the health infrastructure that is available at the time. And so far, it has affected more than 15 countries. This table shows the outbreak period, the location or country that it happened, the species responsible, number of cases and number of deaths, and then the case fatality rate. For instance, in 1976, it started in the Democratic Republic of the Congo, as we've earlier established, with the Zaire Ebola virus being responsible. 380 cases were reported, and there was about 280 deaths, bringing it to 88.1% case fatality rate. And in 2014 to 2016, which was the widespread virus that happened in West Africa, it was also the Zaire Ebola virus that was responsible, with 28,610 people reported to have the disease and 11,308 people died, bringing it to a 39.5% case fatality rate. So this table shows the graph shows the case fatality rates from 1976 to 2023. So one might wonder why 2002 to 2003 is higher than 2014 2016, and that's because in 2002 2003 there were the people that died in comparison to people that had the disease were higher than in 2014 2016, where the people that died were lower in comparison to people that had the disease. And one might argue that that is because the health infrastructure was better compared to 2002, 2003, and also the health infrastructure as well. In Nigeria in 2014, there were about 20 cases and 8 deaths, and the case fatality rate was 40%. And this was because of rapid contact tracing and isolation that prevented wider spread. Currently in 2026, there are about 569 confirmed cases that have been reported in Democratic Republic of the Congo and Uganda, with Democratic Republic of the Congo being the country that has suffered more, with 550 cases, and having 103 cases with case fatality rate of 18%. Um, the Currently, the we've already established outbreak is the Bondibugo Ebola virus. So the table shows earlier what I mentioned about the confirmed cases in Democratic Republic of Congo, in Uganda, the confirmed deaths and the case fatality rate. And the importance of knowing the case fatality rate is because when we are able to know how infectious it is, and the rate at which it is killing people, or the rate at which people are dying, we'll be able to know how well to mitigate and how well to treat and prevent the problem. Thank